countless centuries, men have taken drugs. Based on magic and superstition, ancient remedies came from many sources. The scientific drugs of today come from plant or animal sources, or are manufactured from pure chemicals. Prescribed by physicians, modern drugs cure many diseases and save many lives. Some drugs are administered through the mouth as pills, capsules, or liquids. Once in the stomach or the intestines, these are absorbed into the bloodstream and distributed throughout the body. Other drugs are absorbed into the blood from the lungs, usually as a spray or aerosol. Some drugs, prepared in sterile form, are directly injected into the body with sterile needles. The drug then finds its way into the patient's bloodstream. Sometimes drugs are directly injected into the blood, usually through a vein. Many drugs exert their actions on certain areas of the brain which control most of the actions of the body organs. Other drugs work directly on such areas of the body as the heart or the kidneys. Any regular drug, useful when prescribed by a doctor, often causes great damage and even death if taken improperly and in large amounts. Some drugs are dangerous because when they are used too often, the body learns to depend on them. This is known as addiction. Addiction is a chronic state of intoxication caused by the repeated and continual use of a drug. Because the body learns to adjust to a drug, larger and larger doses must be taken to achieve the same effect. This body adjustment to a drug is called tolerance. The body soon becomes dependent on an addicting drug, and the addict is compelled to use the drug more and more. Severe withdrawal symptoms occur if the addict stops using the drug. These symptoms include nausea and vomiting, shakes and chills, and violent headaches. In drug addiction, one is aware of an increasing tolerance for the drug, compulsion to use the drug, and withdrawal symptoms if the use is discontinued. Drug addiction, a term being replaced more and more by the words drug dependence, not only ruins the individual addict, but creates severe problems for society. Drug habituation may result from a psychological dependence on the drug or from a physical dependence on its effects. The end result is the same. A person with a drug habit may continue to use the drug for its own effects, rather than for the relief of a genuine illness. With the drug habit, there may be an increase in the doses taken over a long time, but tolerance does not always develop. Most drugs which cause habituation or addiction are the ones that act on the brain. The largest group of drugs acting on the brain are the sedative compounds. The most commonly used sedative drugs are the barbiturates. All are variations of the basic barbituric acid molecule. If the molecule is chemically changed, the resulting drugs will react with different speeds and strengths. When used in small doses, barbiturates depress the function of the outer surface of the brain, the cortex. This exerts a calming influence on the patient. In patients with certain types of seizures, such as epilepsy, the depression of the cortex controlling body movements may prevent convulsions. Used in larger doses, the barbiturates will produce sleep. In this case, the drug depresses the cortex and some of the deeper centers of the brain. Overdoses of barbiturates depress even lower brain areas, especially those controlling respiration. Death from the paralysis of the breathing center occurs very often with overdoses of barbiturates. Barbiturate overdosage is an increasingly common method of suicide. There are nearly 4,000 such deaths each year. Barbiturates, when used carelessly, are addicting. Tolerance builds up rapidly, and more capsules must be taken to obtain the same effects. The main danger is that there is very little or no increased tolerance to the fatal dose. People who are addicted to barbiturate drugs often use alcohol excessively. The combination of alcohol and barbiturates, both of which depress the respiratory centers, cause many accidental deaths. Withdrawal symptoms occur in addicted individuals who suddenly try to stop their use of barbiturates. These symptoms include headaches, sweating, extreme nervousness, and even convulsions. Tranquilizers form another group of drugs used to calm anxious or nervous patients. This group includes drugs marketed under such trade names as Equinil, Thorazine, Miltown, and Spari. Tranquilizers are prescribed only by physicians and must be used with great care. As with the barbiturates, the use of alcohol with tranquilizers is very dangerous and may be fatal. Another group of drugs act to stimulate or excite the cells of the cortex. These are called stimulants. The most common drugs in this group are the amphetamines. Common amphetamines are amphetamine sulfate called benzedrine, dextroamphetamine sulfate called dexedrine, and methamphetamine called methadone. In small doses, as prescribed by physicians, the amphetamines themselves are used to cheer up depressed patients, correct certain behavior disorders in small children, and depress the appetite in overweight patients. Amphetamines are often used without a physician's direction to increase alertness and to hide fatigue. Taken as pep pills by students, the fatigue is only delayed and the user feels worse after using the drug. When used illegally in excessive amounts, amphetamines cause nervousness, hyperexcitement, and even convulsions. Judgment is distorted, mistakes are made. Drivers using pep pills are frequently involved in serious accidents. As amphetamines are habituating drugs, individuals come to depend on them psychologically. These often become their only source of confidence and energy. Tolerance may develop, but physical withdrawal symptoms are usually very slight when the drug is stopped. An even more dangerous misuse of this class of drugs occurs when thrill seekers inject methadone directly into their veins. Methadone, often called meth or speed, is injected or shot several times a day for several days. Individuals on such speed runs experience sleeplessness, extreme nervousness, and agitation. Severe depression quickly develops when the run is stopped. This is followed by long periods of restless sleep. To recover from the speed run, a variety of other dangerous drugs is needed. Infections and abscess of the veins and the liver are very common among speed freaks. Both amphetamines and barbiturates are now classified as dangerous drugs. Neither can be bought legally without a doctor's prescription. Both groups of drugs are very useful when handled wisely by medical doctors and scientists. Both are illegally abused by immature and foolish individuals. The results are tragic deterioration of physical and mental health, and often death.